Grady.
Mr Speaker, will the Secretary of State join me in welcoming the formation of the All-Party Parliamentary Group on Blood Donation, and will he agree to take part and perhaps give evidence to its inquiry on the criteria around blood donation, particularly as regards men who have sex with men?
Yes, Mr Speaker, the Department has asked, as members in the House will know, the Advisory Committee on the Safety of Blood, Tissues and Organs, SABTO, to review the donor selection criteria for men who have sex with men for blood donation. SABTO have now approved the remit, their terms of reference, their work stream, so they're cracking on. They've got a second meeting coming up later this month, and I know the chair of SABTO the working group has written to the chair of the All-Party Group welcoming the inquiry and inviting them to contribute evidence during the autumn.
Martyn Day.
Thank you, Mr Speaker. In March, the Scottish Government committed to substantially increase financial support for the victims of contaminated blood. This will initially require to be administered through the current system, but the Department of Health appears to be dragging their feet. Can the Secretary of State explain the cause of the hold-up and how he plans to expedite these payments for people with life-threatening illness?
Yes, I've actually had a number of discussions with the Cabinet Secretary. No one is dragging their feet. We are trying to get this sorted out. I've had a number of discussions with the Cabinet Secretary for Health and Wellbeing. We're working together to facilitate the increased payments using the current scheme administrator. I most recently spoke to Shona Robertson last Thursday. We want to get these payments made as quickly as possible to people infected in Scotland and across the UK. And officials in the Department of Health and officials in Scotland are working closely together to expedite this matter.
Ritchie.
Could the Minister for Public Health confirm when a statement will be made to the House on the contaminated bloods issue, and particularly the response to the consultation that closed in April of this year?
Minister.
Well, Mr Speaker, I'm not in a position to be specific about when we can make a statement, but I can give her and other interested honourable members the absolute assurance that we continue to look very closely at this. We've read absolutely every single response that we've got. I did meet a very well-attended group, all-party group meeting on the 25th of May and gave people a sense of the direction of travel of our analysis, but I hope to keep the House updated.
Finally, Mhairi.
An elderly constituent of mine came to my surgery to explain that her husband had sadly passed away due to becoming infected with hepatitis C during the contaminated blood scandal. But she's applied to the Skipton Fund 4 times and has been continually denied because her husband's medical records have since been destroyed since his death. Can the Minister offer any advice as to how I could best move forward with this? And I would also be happy to meet with the Minister to give her more background information.
I think, Mr Speaker, the latter suggestion might be the best one. Happy to meet the Honourable Lady and talk about it in more detail.
Order. Point of order.
Point of order, Mr Speaker. Could I perhaps indulge the slightly more relaxed atmosphere of the House, just to offer a broad thank you. 24 years and 1 month ago, I answered my first question as a junior minister in the House in oral questions, and I've just completed my last oral questions. This is not a sudden post-Brexit resignation. It's not catching. And a few weeks ago, I made clear to the Secretary of State and to the Prime Minister and the Chief Whip that I wouldn't, after the referendum, be seeking a post in what I expected to be a reshuffled government. And in the event, I hope to carry on with my duties until September, but there won't be another oral questions. So, taking the chance that most ministers don't get, because we never know when the end will come, could I thank colleagues for their forbearance over many years in subjects as varied as child support, disability, the Arab Spring, and the relentless pursuit of mental health data from the Honourable Lady from Liverpool Wavertree. To thank colleagues very much for their forbearance, to say I'm looking forward to taking part in more questions from another seat in the Chamber, but to wish all colleagues very well indeed.
I will come to the Honourable Lady's point of order. Can I just say to the Minister of State, though that is a relatively unconventional method of expressing appreciation, he was typically courteous in signalling in advance to me his wish to do so. And I simply want to say to the Right Honourable Gentleman, and I think I can say it without fear of contradiction, and it was evident from the response, that he is an extremely popular and respected minister who commands widespread affection and loyalty in all parts of the House, and we very much look forward to his continuing contributions, albeit in the future, from the backbenches. I thank him for what he said and for the way in which he said it. Point of order, Valerie Vaz.
Mr Speaker, exactly on that point, could I, on behalf of everyone on this side, pay tribute to the honourable member. He's been an absolutely fantastic minister, and he is a brilliant MP, and long may he continue.
Well, that's extremely welcome, and I thank the honourable lady for what she has said.